And now, Dr. Leonard Rodberg, Professor and Chair of Urban Studies, Department of Queens College, and if I am remembering correctly, the author of a recent interesting letter in the New York Times, Dr. Rodberg?
Mm-hmm. Mm-hmm.
Thank you. Dr. Rodberg.
I'm going to use slides, which are there for those of you who can see it. Well, let's try again. So, and there's a lot of information in them, so you can look at them separately. They'll also be on the website of the New York chapter of PNHP. It's www.pnhpnymetro.org. Here's a reminder on where the U.S. stands in comparison with the rest of the world. This is the history over the last 15 years of the cost of medical care. Every one of these countries provides universal coverage for everyone. They do it at less cost, and their costs rise more slowly than ours. My message here is they must be doing something right. Here we are up here with rapidly rising costs and 40 million, over 40 million uninsured, and millions more, as I'll describe in a minute, underinsured. What's the difference? They have a strong role for government in both funding and in regulating their healthcare system. Here's data now on the uninsured and underinsured. This is from the Commonwealth Fund. 60% of adults, according to their estimations, are either uninsured or underinsured in any given year. Underinsured meaning they have problems paying their bills or they have problems accessing medical care because of the cost of medical care. So the people who don't are this orange, this maybe yellow slice here. 35% in the surveys say that they had no problem. The rest have problems. Another way of looking at it is here's the problems that the cost of medical care creates for millions of us. We get contacted by collection agencies, as we just heard from Marilyn. People mortgage their homes to pay for their medical care. Hundreds of thousands each year declare bankruptcy because of their medical costs. Overall, according to the Kaiser Family Foundation, 37% have problems, these kind of financial problems as a result of the way our medical system works. And underinsurance is growing. This is from federal data analyzed by the Families USA. Between 2000 and 2007, the percent of families, the number of families experiencing underinsurance, the number of people went from 30 million up to 50 million underinsurance, and these are the uninsured. The definition of underinsurance here is people who have had to spend 10% or more of their pre-tax income on medical care. Here's an example for those of you who are federal employees of underinsurance. Here somebody was in a hospital for 2 days for bronchitis while they were there. They had a serious case of bronchitis. While they were there, the physicians did some tests of their heart as well. The total bill here is over $20,000. The insurance company paid $12,000. After a little negotiation, this is the federal plan, this is Care First, which probably most of you are on, the Blue Cross Federal Employees Plan. After a little negotiation, the person was left with a copay of $1,500. That's for 2 days of hospitalization. That's an example of the kind of thing that people experience. Now, it's interesting that you hear that people like what they have. And so this slide attempts to explain how to understand that. The point, this is often referred to as the 80-20 rule, that 80% of our medical costs in any given year or any given period are spent taking care of 20% of the population. So here, this is again federal data for the year 1999. The federal government runs a survey called the Medical Expenditure Panel Survey, and this is that data. Who is the underinsured? They're the people who have high medical costs in any given year. The message, I believe, is that we're all underinsured. It's just that we don't know it until we get sick. The people down here with very little or no medical expenses don't know that they're underinsured because they haven't actually had to use the system in the way that the two previous people who take care of patients see every day. So this is, I think, an important perspective to keep in mind. Well, what's being proposed? The New York Times reports to us today, this is what's being proposed. What I'll call here the private-public mandate model. Why do I have this man up here, Richard Nixon? The reason is that he was the first president to propose a mandate. He proposed that employers be required to provide insurance for their employees. And the plan is now up in the various committees of the Congress. What does it say? It says everyone is mandated to have insurance. Employers should offer insurance or contribute to a federal fund, which would subsidize the individuals who don't get insurance through their employers. They would have to buy it. There would be continued reliance on private insurance, perhaps with the option of buying a public Medicare-like plan. The plan states, and the president has said this repeatedly, you can keep what you have. If you can keep what you have, and if a lot of people do keep what they have, there will continue to be widespread underinsurance. And if that continues, the problem will be not the lack of insurance, it'll be the insurance that people actually already have. These plans don't envision any regulation of insurance company premiums or of their practices, their reimbursement practices or their denial practices. You will hear about regulation, but the regulation simply would say they have to take you as a customer, but it doesn't control their behavior once you're in their throes. This kind of plan will increase the system by hundreds of billions of dollars. The president, as you probably know, has proposed a down payment on that, but hundreds of billions is what any estimate will say, and I'll show you one in a minute. And finally, there's no way to control costs within this system as long as there are many separate payers. It is proposed that there are ways of controlling costs. This is what the Congressional Budget Office says about this kind of a plan. This is from their study. Their report just came out in December. They say, first of all, if you rely on mandates, you're not going to get universal coverage. That our experience with mandates, we have them nationally in a lot of different ways. We have income tax requirements, we have child support requirements, we have auto insurance requirements in every state, and yet the experience is that mandates get you anywhere from 63 to 86% towards 100%. At the moment, 85% of all adults already have insurance. So a mandate will not, according to the CBO, lead to 100% coverage.